Promoting healthy behavior is an essential component of nurse practitioner practice. Assisting persons to change unhealthy behaviors may help prevent chronic disease and disability. The core competencies of nurse practitioners refer to coaching for positive behavior change, as well as developing respectful relationships with patients, allowing them some control over their own plan of care. There are more components to the patient encounter besides history and physical taking. Motivational interviewing is a method that has been researched and shown evidence that this technique results in a positive behavior change. Unfortunately, this requires a talent that is not always taught or learned in the nurse practitioner education. In the current healthcare system, this will be a vital skill set as consumers and stakeholders alike are looking for reduction in disease complication, prevention of disease progression, and improved quality of life. In this next video clip, we are going to see the provider with a patient discussing their smoking history as well as ways to quit.
From reviewing your record that you were a smoker.
Yes.
How long have you been smoking for?
About 20 years.
How much do you smoke on a regular day?
About a pack a day.
Have you ever thought about maybe trying to quit?
No. I enjoy smoking.
Did you ever try quitting before in the past?
No.
Do you know that it's bad for your health, right?
I do.
It'll contribute to your aging. It could even help contribute to heart attack, stroke.
I know.
You know, we need to
it's
make
relaxing.
We need to make this a priority in your health.
I'm really not interested in quitting at this time.
The dynamics of this interview were not conducive to addressing or reducing ambivalence with the prescribed change. This is where the elements of motivational interviewing will attempt to produce a better outcome. The 4 elements of motivational interviewing include open-ended questions, affirming, reflective listening, and summarizing. Open-ended questions facilitate a client's response to questions from his or own perspective and from the area that is deemed important or relevant. Affirming means to actively listen for the client's strengths, values, aspirations, and positive qualities, and to reflect those to the client in an affirming manner. Reflective listening entails a skillful manner of responding to what a client says. In motivational interviewing, one responds to clients with more reflective statements than questions. Lastly, summarizing is an important element in motivational interviewing. Sessions are ended with strategic collaborative summary. The next video that we're going to see is the same patient and provider using a different technique in order to discuss smoking cessation.
Brenda, I've noticed from reviewing your chart that you do smoke.
Yes, I do.
How long have you been smoking for?
About 20 years.
How much do you smoke on a regular daily basis?
At least a pack.
Now, you've been smoking for this long. What caused you to start smoking? What's some of the reasons that you smoke?
I just enjoyed it. I found it comforting. It was kind of a social thing to begin with.
Now, to you, what are some of the disadvantages from smoking?
Well, my family hates it. It's gotten to be outrageously expensive. And I'm noticing in the morning I'm getting a hacking type cough.
Have you ever tried or attempted quitting?
I did, but I'm usually not that successful.
What in your opinion will be some of the benefits if you quit?
Well, I know I'll start to feel better. I know I'll save some money and my family would be ecstatic.
So, for me, what I'm hearing from you is that you want to quit.
I do.
We do have ways of helping people with quitting.
In fostering collaboration, the provider honors the autonomy of the patient and evokes the patient perspective, thus enabling successful change in the patient's healthy behaviors.